The Facilitator MD, back at you again. This week, let's talk a little bit about something that's important to all of us because all of us know a woman. We all have either a mother or a grandmother or a sister or an aunt. We all are here because of women. The United States healthcare system, however, has had and continues to have a lot of challenges in dealing with some of the health-related challenges with women. We're talking today to a specialist who tells us a little bit about some of those challenges and what the system or what certain people within the system are doing to help the healthcare system address women's healthcare challenges. Hit the subscribe button below. Click it. Notification below. Click it so you can be notified of any new videos that come out from this channel. As an obstetrician, I want to get a little bit more information as to some challenges that we're seeing in the OBGYN world. Okay. So firstly, what's your name and what's your title so people know where this information is coming from?
Sure. So I'm Dr. Tamika Auguste, and I'm a practicing OBGYN, and I am chair of OBGYN at MedStar Washington Hospital Center.
And you speak a lot nationally about OBGYN issues. Tell us a little bit more about where you've spoken and on what topics specifically.
Sure. So some of the things I've spoken on, particularly in OBGYN, nationally at different conferences around education of OBGYN, patient safety, simulation, and health equity in OBGYN.
Okay. So again, COVID has unmasked a lot of healthcare issues, challenges. And one that we're seeing is challenges in the care of women, in women-related services. Why should all Americans be specifically interested in how the healthcare system has been failing women?
Great question. So when we speak about how the healthcare system has failed women, that touches everyone, even if you don't identify as a woman, because everyone in this country has a mother, a sister, or a daughter, and they understand what that means in terms of a healthcare not appropriately treating this person that identifies as a woman. So that's why it is important. The other thing to understand is that in the world, particularly in obstetrics, we have been now very transparent. We've put it out there. We have identified the health disparity and inequity among Black women, Latinas, and Natives. And now we have to do something about it.
And that inequity, we're talking about inequity in outcomes, healthcare outcomes. So there are gaps between the outcome in healthcare between women who are of certain races and ethnicities. Would you say that that gap is a conscious deviation of care between patients on the part of physicians?
It's a very sensitive topic, but it has to be spoken about, and it's real. I don't think people go into medicine, particularly physicians and other healthcare providers go into medicine to purposely give inequitable healthcare treatment. So my opinion is that this is really a lot of unconscious bias around the disparities that we are seeing. This is deep-seated. This goes back a long while. So one, recognizing it, we've put our data out there. It is out there everywhere. Most people know that Black women are 3 to 4 times higher to dying in labor than non-Black women. Like, that's a very big statistic to put out there, okay? We've done it. Now we have to do something about it. That's the only way we're going to make this change. So in that same vein, we have to talk about it. Everyone has to talk about it. If we think that obstetrics is the only one that has this disparity, then we're highly mistaken. So this is the start. We have to talk about this unconscious biases that we as healthcare physicians and providers are seeing, and we have to deal with it.
I think it's absolutely important what you're doing. You are giving voice to the system that you represent. You've trained half your life to learn to do what you've done, and that is the treatment of women. In 3 years, this information has become more public, and you and your colleagues have worked to lessen the gap. How has that worked? What have been the outcomes since your OBGYN colleagues and system has been addressing this issue?
So over the past 3 years, in the past 3 years when we've really just been honest and put it all out there, right? We are starting to do the work that's necessary. We haven't seen the big changes and the decrease in the gap that we would have hoped to have seen. But I have to say, I think it's too soon. This gap exists because of decades of bias. And to think that we're going to undo it all in 3 years is, I think, is not appropriate. It's not reasonable. It's not feasible. What we've done, it's multifaceted. We've done different things, we're hitting this from different avenues. So not only individual training, individual awareness of your own biases, practicing as teams, funding from different organizations, including our federal government, on different bills, extending Medicaid for 1 year after delivery. But all of this takes time to do, and I'm not making excuses, but we have to put the right things in place in order to have this done correctly. So I think we are doing a good job, always could be done better, by getting the right things in place. Now we're going to start to truly execute. I think we need more time to undo this. Again, I can't say enough. Decades of bias, decades of racism, and we can't undo it in 3 years. We need more time. We will do it. I am confident we will, but it's going to take time to unlearn all the things that we have been doing.
And as members of the public, can we feel confident that now that leaders such as yourself are on the case, that it will turn around through training and through education, or are we kind of just hoping that people will address this bias issue that, as you stated, has gone on since the beginning of healthcare as we know it?
I am confident to say that it is going to change. It's going to turn around. Why? Because we not only have individual, organizational, local, community, states, but we also have national endeavors pointed towards this to change. And together we're going to get this done. It's unfortunately just going to take time. So even we are engaging our patients and patients' families like we've never have before. There should not be any OBGYN healthcare provider that is not talking about these disparities, these inequities, and should be able to talk to you as a family member or as a patient about what they're doing to make a change here.